What's up, you guys? My name is Miguel, fellow Xray Tech here, giving you your daily dose of radiation. In today's video, we are covering the beloved energy drinks in the medical field. So, to give you context, I am a night shift Xray Tech. I've been doing it for about 4 years. Also dabble in a bunch of overtime, so I dabble in both days and nights. And my lady's a nurse for other context. So, the beloved energy drink. So, as we all know, energy drinks are not exactly the best form of getting caffeine. I would say the most healthiest would probably be some coffee, some green tea, or probably taking some caffeine pills would probably be the more safer route, I would say. But as we all know, the energy drink business is booming. Like, if you work in the hospital, any medical worker, you'll see them. Usually it'll be depending on how tired they are, especially night shift. Night shift, I would say, probably triple the amount of caffeine out of anyone else. A lot of the time we'll see doctors with a little cup of OJ, a little Starbucks, you'll see that. But that's mainly day shift. Sometimes you'll see some energy drinks, but a night shift, it is almost strictly all Monster, Red Bull, Bangs, Regen, like all the energy drinks, especially at nighttime. I myself am guilty of indulging in some, but it's mainly because I work an ungodly amount of overtime, and my sleep schedule, because I got like kids, is not always the most optimal. So I'm like, but you do see a lot of people consuming energy drinks. I mean, a bunch of the cardiologists and stuff up there do not recommend drinking energy drinks, especially a lot, but then sometimes themselves are drinking it and they're like, well, gotta do my job, gotta do this, gotta do that. So it comes with a double-sided sword. So you do see a lot of energy drinks, and even at the hospital, they know they sell a lot, so they have an upcharge in price, which just in general, even gas stations around the hospital carry energy drinks, and they will charge the price. Even just post-COVID, I've noticed, because when I was in Xray school, some of the energy drinks and stuff, it was a little bit expensive, but now I've almost seen a pretty significant boost in price compared to when I was in college. And in college, I was probably running on 1,200 to even 14 milligrams of caffeine, which is a lot. Like I was like doing the little head tweak, and it was bad. It got to the point where it was pretty bad. Like, I would drink, I think I was doing like four of the 300 milligrams. It was bad. Like at one point I was drinking them, like I didn't have a choice to, because my body, if I didn't have it at a set time, my body would crash. And like some of my clinical sites were like super far away, so I had to drive like really far. I think it was like an hour. And like one time I would chug it when I would be studying at night, and one time it was pretty bad. I just passed out after drinking it. Like I was just tired. But I mean, it's not necessary. I mean, I've noticed as long as you get like a good amount of sleep and your body's pretty well rested, don't really need energy drinks overnight, like with a coffee, and as long as you're kind of moving around, even for us in night shift, you'll be okay. But most of us don't really sleep a lot, or if you work a lot and you don't, like I notice my body, if I start off, because I work 7 on 7 off, by probably night 4 or 5, I might start to dwindle down and I might need something. But as long as I sleep on the weekend, and I'll kind of boost me through, and I won't really need caffeine. It's a little bit more harder right now because I'm trying to I'm in a calorie deficit, and I'm trying to get a little bit more slimmer post college baby weight, I guess. So it's a little bit harder on your body, but it's not necessary. But I mean, sometimes you gotta do what you gotta do. I mean, I really don't do anything else with my body, like, because like there's people who drink, smoke, doing it. Like I don't do none of that. My body's pretty clean. I never done any of that. So like, I guess if this is like the worst thing possible, I'd be like, I'll be okay. But even post-college, you will still see energy drinks, and you too will probably be indulging in a few. There's various ones. I've noticed certain ones give me migraines, certain ones give you the tingling effect, and some of the people with heart problems I would not recommend. My lady has heart problems, and she sometimes drinks energy drinks, and it does not go well for her. So, it's been your boy Miguel. See you on the next one.